Welcome to the deep dive. If you're working as a clinical coder in the UK, listen up. Your whole professional standing, really your career path, it hinges on one key thing.
That's right. And it sounds simple, but thousands actually make a costly mistake right out of the gate.
A costly mistake, okay.
Yeah, absolutely. For you, the listener, getting qualified and being seen as credible in the NHS framework, it really starts with being part of the right professional body.
Get that wrong.
And you've basically hit a dead end. Wasted money, wasted time before you even think about exams.
Right, okay, let's clear this up immediately then, because I hear this involves confusion around an acronym, IHRM.
Exactly. That's the heart of it. Happens all the time.
So spell it out for us. Which IHRM is the right one?
Okay. The one you absolutely need in the UK is the Institute of Health Records and Information Management. Their website is ihrim.co.uk. Remember the .co.uk, they were set up way back in 1948.
The proper UK one. Got it. And the mistake.
The mistake is accidentally joining the U.S. body. Similar name, International Association for Human Resource Information Management. That's IHSHIM.org. Totally unrelated.
Unrelated how?
It's all about HR technology, human resources stuff. They have their own certification, HRAP, but it means nothing for a UK clinical coder.
And you end up paying their fees, which are, what, around $200 US?
Yeah, something like that. And for that money, you get absolutely zero professional benefit for your actual job here in the UK. You're just in the wrong ecosystem completely.
Okay, costly mistake avoided. So let's assume you found the right IHRIM, the UK one. Why is membership so critical? You said mandatory.
It is mandatory.
Yeah.
Because IHRIM UK isn't just a professional body, it's the authoritative body here. And crucially, it's the only organization that can award the National Clinical Coding Qualification, the NCCQ.
Ah, okay, so it's not just about, networking or looking good. It's the literal gateway.
Precisely. Membership is a strict prerequisite. You cannot even register for, let alone sit, the NCCQ exam without being an IHRIM UK member first.
And the NCCQ is the only coding qualification the NHS formally recognizes.
That's the one. It's the gold standard.
Yeah.
If you want that official stamp, this is the only path.
And I hear that exam is pretty tough.
That's putting it mildly. The practical exam part of the NCCQ, it demands an exceptionally high pass mark. We're talking 90%.
90. Wow, okay, that's intense. Why so high?
Well, think about the impact of clinical coding. It directly affects NHS funding, how resources get allocated, clinical audits. The accuracy has to be absolutely spot on. There's very little room for error.
Right, makes sense. High stakes. So that 90% bar tells you the level of competency they expect.
Exactly.
Yeah.
Which brings us back to membership value. It's not just paying a fee to sit an exam. It's an investment in actually passing that tough exam.
How so? What do members get that helps them hit that 90% mark?
Well, a key benefit is free or discounted access to something called the Monmouth Academy.
Monmouth Academy.
Yeah, it's an online platform. And it's specifically designed with things like bite-sized lessons, lots of exam-style questions, quizzes. It's all geared towards preparing you for the specific demands of the NCCQ.
So tailored exam prep, basically,
Yeah.
from the people who set the standard.
Pretty much. You also get exclusive access to important documents, like the IHRM Health Records Good Practice Guidance.
And why is that important?
Because that guidance is recognized as authoritative by the Care Quality Commission, the CQC.
Ah, the CQC. Okay, so having access, knowing that guidance, that's kind of like your professional compliance toolkit. Helps keep you aligned with what regulators expect.
Definitely. But think bigger picture, too. Strategically, membership isn't just about the here and now, the exam, the current rules. It's about your career trajectory.
How does it help with that?
It opens the door to registering with the Federation for Informatics Professionals in Health and Social Care. You might know it as FDIP.
FDIP, right. Heard of them.
So through IHRIM, you can get onto the FDIP register. And that allows you to reframe yourself. You're not just a clinical coder anymore. You're recognized as a broader informatics professional.
And that opens up different career paths.
Absolutely. Things like data analysis roles, information governance, maybe health IT project support. It broadens your horizons within the health informatics landscape.
Okay, that's a significant long-term benefit. Let's get practical, though. What's the initial cost? If you're just starting aiming for the NCCQ.
Right, so you typically start with the NCCQ student grade membership. As of, well, the figures we have are April 2020. It was around £92.40 for the whole year.
Okay, under 100 quid.
Yeah. And one important point, you have to pay the full year's subscription up front before you can even register for the exam.
Right, full year in advance. And after you pass.
Then you'd move up to the accredited clinical coder grade, which is the professional grade. That was slightly more, around 126 annually back then. But again, for a mandatory credential and all the resources, it's a fairly minimal investment.
So you get qualified, you maintain your membership, but the journey doesn't stop there, right? You mentioned career trajectory.
Exactly. Being competent is the baseline. The real goal should be continuous development. Proactively engaging with CPD, using resources like the FedUp Pub community.
And that leads to?
Well, that's how you potentially move towards the highest grade,
Yeah.
which is Fellow of the Institute. More importantly, it's how you start to actively shape the future of health informatics, not just react to changes.
So it's about moving from practitioner to potentially a leader or influencer in the field.
That's the idea.
Yeah.
It's about building your professional identity.
Which brings us to a final thought for you, the listener. Since joining IHRIM UK and potentially registering with FedUp reframes you as this broader informatics professional, maybe it's time to think beyond just coding accuracy. What specific skill, maybe in health IT, maybe data governance, something outside pure coding, are you going to target for your next CPD goal? Something to think about.